So our next presenter is Dr. Guneet Pal Singh. He is from Hyderabad, and to be precise, he is the youngest of all the 12 participants who are presenting today. At present, he is a house surgeon and will be completing in next 2 months. So he is practicing since 2016, almost 6 years of practice at Singh's Homeopathy, which is there in Hyderabad. So welcome, Dr. Guneet, and all the very best for your presentation. So your time starts now. You can start.
Good morning, everyone. I'm Dr. Guneet Pal Singh from Hyderabad. Today, I am going to present a case on thyroid. I have recently treated a case of thyroid disorder. A female lady of age 45 years residing in Mumbai, she came to my clinic on 11th December 2020 with the complaints of painful menstruation since 6 months, pain in all joints since 1 year, and swelling under the eye since 2 years. On taking the history of the patient was apparently healthy 2 years back. She gradually developed bag-like swelling below her lower eyelid, which was not painful. She consulted her allopathic doctor and was advised for investigations. After the investigations has been done, the TSS levels revealed as 14.9 on 19th January 2020 and was advised to use thyroxine 50 mcg. She had pain in all joints, which were aggravated by touch, pressure, sitting, summer, slight exertion, movement, lying down with rest, and associated with weakness and emaciation of whole body with gradual weight loss. So I have asked about her menses. Before the onset of menses, she experienced unbearable pains, which makes her cry. Profuse menstruation with dark clotted blood. Menses cycle was 8 days. Patient experienced sudden heat from palms and sole. I have taken her past history. She had diabetes since 1 year and she was on medication, and also diagnosed as hypothyroidism and using thyroxine 50 mcg since 2020. I have asked about her family history. There was no similar complaint in her family history. All were healthy. Then I have asked about her mental generals. I have noticed some symptoms like she was very introverted, calm. She explained in Hindi like जब भी मुझे गुस्सा आता है तो मैं किसी से बहस नहीं करती हूँ और साइड में जाके बैठ जाती हूँ और रोने लग पड़ती हूँ. Anxiety about her children's future, worried about her health, mainly the weight loss, desire to travel, forgetfulness, constantly feels as if she has forgotten something and does not know what. उन्होंने एक एग्जांपल दिया, जैसे मैं फ्रिज में जाती हूँ कुछ लेने के लिए और जाने के बाद मेरे को याद नहीं आता मैं किस चीज के लिए यहाँ पर आई हूँ और मैं वापस आ जाती हूँ. Desire to walk in open air, hastiness while walking, and there is tendency to weep, fasting aggravation, hunger is very intolerable. So coming to the physical generals, in this mainly there was desire for sweets, but she वो यूज नहीं कर पा रही, मतलब वो स्वीट्स नहीं खा पा रहे थे क्योंकि उनको डायबिटीज थी. उनको आइसक्रीम बहुत पसंद थी और पिकल्स बहुत पसंद थे. एंड एवरीवेयर वर जनरल सिम्टम्स. On the main thing was there was ravenous hunger. So on taking the thermals, the patient was hot. Coming to the female history, I have asked about the menstrual history. The menarche was at the age of 13 years. Cycle was 8 by 30 days. Dark red clotted blood. There was dysmenorrhea before the onset of menses and on the first day of menses. Pain decreases with the flow. So main thing was there was great weakness during menstruation. I have done the physical examination where I have noticed that the patient was very thin and lean, British complexion. Main thing was the patient's age was 45 and the weight was 36.4 kg in year 2020. That was the main important thing in this. So on the basis of symptoms, it was diagnosed as primary hypothyroidism. So after taking the totality, we have evaluated symptoms. Patient was hot, appetite was good, but losing flesh, desire to travel, forgetfulness, pain during menstruation, which was unbearable, weakness during menstruation, pain in all joints, worried about health, bag-like swelling under the lower eyelid, desire for sweets, profuse and prolonged menstruation. So after taking the totality, I have done the repertorization. These were the symptoms which were taken in consideration, and the main remedy was Cipia, which was covering all the symptoms. You can see on the screen which I have selected. So on the basis of repertorial totality, Cipia was covering all the symptoms with the marks of 46. So I have selected the remedy Cipia 30. 3 doses were given on 28 December 2020 and Rubrum 4 pills twice a day. The reason for which I have selected Cipia 30 was, these were the rubrics I have taken from that: mind forgetfulness, travel, desire for, anxiety, health about, quiet disposition, swelling lids lower, menses painful, dysmenorrhea, profuse, irregular, prolonged, heat flushes off, weakness, menses during, fasting, hunger aggravation, summer aggravation, lean people. These were the few of the symptoms which I have considered that they were very important for the case. So I have taken some of the follow-ups over the call because the patient was in Mumbai, and some follow-ups in my clinic. So on 2nd Feb 2021, there was much relief of complaints, given Cipia 201 dose. And after 2 months, she again called me and told that there was pain during menstruation, but I still wanted to wait. So I have given Rubrum for 1 month. And on May 17th, there was much relief in all complaints, but some few symptoms were left out. So I have given Cipia 200 again, 3 doses. Then on 2nd of September, August, there was pain during menstruation, profuse menstruation. Then again, I have given Rubrum for 1 month, and I have added up biochemic MAC for 6X, 4 tablets BD. On December, you can see menses delayed for 1 month with irritation, mood swings, angry, TSH levels, but they were reduced to 17. There was slight relief of different other complaints. So then I have repeated Cipia 1M, 1 dose. And after 2 months, everything was going good, but some of the symptoms were still remained. So on January 2nd,
2 more minutes.
Swelling has increased with further weight loss. So I have given iodine 34 pills BD. There was much relief in all complaints. All the complaints were relieved. I have given iodine 200, 4 doses, weekly 1 dose. And after that, the TSH level has come to 1.3. So you can see the left side one are before the homeopathy treatment, and after homeopathy treatment are mentioned on the right side. You can see a drastical change. These were some of the proofs which I have taken from the patient, and 14.9 on 19th January. On allopathy treatment, again it has raised to 27 on 16th December. When I have started the homeopathy treatment, this was the repertorial totality which I have considered iodine for that. Reasons for selection of iodine: hot patient, bag-like swelling under the eyes, cannot tolerate hunger, heat aggravation, forgetfulness, great weakness during menstruation, dysmenorrhea, ravenous hunger, good appetite, loses flesh, weight loss, weakness, emaciation of whole body. These were the reports when I have started the homeopathy treatment, and during the first follow-up, it was reduced to 17. And in this year, 2022, March, these were the reports, and there was a drastical change, 1.3, magical results for me. So this I have mentioned for you all, that before homeopathy treatment and after homeopathy treatment. And main thing was with iodine, there was a drastical change in the weight also. First, the weight was 36.4, and after homeopathy, it has come to 41.2. That's the main thing. And also the sugar levels has decreased. On 27th March 2022, the weight was 41 after the administration of iodine 200. And you can also see the fasting blood sugar has decreased to 188. In this, homeopathy cures a large percentage of cases than any other mode of treatment and is beyond doubt safer and more economically and most important, most complete medical science. And I have taken these lines, bookish knowledge may guide the way, but practical knowledge experiences the way. आप जो भी बुक से पढ़ते हैं वो जरूरी नहीं आपको हर पेशेंट में वो दिखे, बट जो पेशेंट में दिखता है वो अलग ही एक्सपीरियंस रहता है. So this was the aphorism given by Dr. Samuel Hahnemann. And finally, this was the end of my presentation. Thank you. I hope you all liked my case.
Thank you, Dr. Guneet. Very encouraging and all the very best for your bright future. Do good. So Dr. Gautam is from Rajhamundry, Andhra Pradesh. He has completed his PG in 2020 and he's practicing since last 2 years at his own clinic, that is Amar Homeo Clinic at Rajhamundry. I welcome Dr. Gautam for his presentation and all the very best. You can share your screen and start.
Thank you. Am I audible?
Yes.
Is it visible, madam?
Yes, visible.
Good morning, everyone. Thanks for giving this opportunity. And this is an acute case. How an acute case can be understood in a holistic way, and how a prescription can be accurate. So, because of this reason, I have taken an acute case and presenting in front of you. And this is a case of streptococcal infection. A male patient aged about 70 years came with complaints of severe itching with pustular eruptions, appeared after tonsuring his head, and the eruptions were present all over the body. Used allopathic medicines for 15 days, but without any good expected result. So he consulted me after 15 days of his complaint. If you can see the eruptions all over the head, on ears, and hands, both right and left hands. So initially I have done home consultation. One of his relative asked me to get a home consultation, so that I went to his home. The patient was so anxious with severe restlessness, moving here and there, and extreme fear that it may end his life. He was keep on telling that this is going to end my life. So and he was keep on roaming here and there in a room. He was keep on roaming here and there, and he's uttering a word that it's going to end my life. Severe itching both day and night, feels better by dipping into hot water. And this is the initial information he had given. So based on the above information, I had prescribed him arsenic amalgam 30C water dose thrice a day for 3 days. And the result, if you can see, it is utter failure. The result was utter failure without any change at all. Then I applied the sensation method by understanding the whole. Yes, tell me. Severe intolerable itching, sensation as if thorns are pricking. Cough with rattling in the chest and constipation. Having severe itching in the soles with sleeplessness. Frequent dryness of lips. What else? Itching, sir. How this complaint is bothering you? I couldn't able to fold my hands. I need to scratch day and night. I feel restricted by this. I'm not free as before. I feel restricted by staying in these 4 walls. I asked, free as before, meaning daily morning I wake up at 4 a.m. Without failure, I perform pranayama and yoga. By performing yoga, I feel my body moves freely. After yoga, I do garden work for 45 minutes. My body gets still more free. This complaint and these people are restricting me by not performing my daily routine. Now I feel dull without any activeness in my body. He says that even this problem is not at all bothering me, but this these people and this problem is restricting me, not able to, not they are not allowing me to go outside. I asked, dull without any activeness means if I feel dull, I move here and there for 30 minutes by watering plants and gardening them. I feel free and happy. I didn't get you. Dull means by being dull, I cannot move. I feel my joints and body stiff. I feel any of the joints gets caught tight and cannot move anywhere. And all my works get halted. And I feel that my body is not in my control. And then I asked, only as this is an acute case, uh, once the area is confirmed, I shifted to other area. Hobbies. What is your hobby? Yoga and gardening. What interests you in that? Nothing much. By performing them, I feel free. I can move my body freely without any stiffness. So this is the hobby which he likes, and so that by gardening and performing all his works, he feels free. In general, this is. Then I asked, which fruit do you like most by not considering your diabetes mellitus? And he's known diabetic mellitus for the past 15 years. Then he, without spontaneously, he said mango. Then chief complaints, skin complaints, vesicular and pustular eruptions, offensive discharge from eruptions, itching worse at night, better by hot water application. Analysis. Based on the above information, by polarities of stiff and free and stiff, caught and free, wants to move always, feeling of restriction, the skin complaints of nightly aggravation and better by hot water application. Based on Medica with systematic understanding, I prescribed him Rasvenata 30C thrice a day, water dose for 5 days. On 16/4/2021, the itching was better by 50%. Again, Rasvenata 30C twice a day for 7 days, followed by SL for 15 days. On 1/5/2021, itching better by 70%, swelling of foot started. All his lower limbs got swelling, and I had done a urine examination, whether there is any creatinine or any urea like that. I had done a urine routine analysis, and everything was normal. And Rasvenata 200C, 2 doses. The following that, I have prescribed Rasvenata 200C, 2 doses for 2 days, SL for 1 week. On 8/5/2021, no any improvement in swelling. Itching remained the same with 70% improvement. Waited for 2 more days, but no any marked improvement in swelling. Done urine examination and the results were normal. And then I have searched Clark Medica relationship. In that, he has mentioned clearly that Rasvenata follows Rustox. Then I have done. Then I asked. Then I have read Rustox lower limbs in Clark Medica. What he has given: swollen round ankles after sitting too long, particularly in traveling. And this is the exact line given by Clark in Rustox. After going through lower limbs in Clark Dictionary, then I asked, do you have swelling of feet in your life previously? Yes. If I travel by sitting for more than 1 hour, I'll get. And this is the answer he has given. Then I had prescribed Rustox 200, 5 doses for 5 days, SL for 15 days. After 1 week, after 15 days, his lower limbs edema and everything got settled down. Rasvenata 30C, 200C followed by Rustox 200C got complete recovery of this patient. And not only this, after prescription of Rasvenata, he feels free in general. Even though the complaints were there, 70% or 80%, he feels much better. Not only his complaints, even his mind got relieved. No problem. Now he can able to sustain. No any fears like that. He started saying like that. And these are before and after pics. And this is a total recovery of the patient, not only in complaints, but all over the holistically as a whole. Thank you. Thank you for giving this opportunity. I should thanks to Swara team and Shekhar sir and organizers for creating this great platform and opportunity. Thank you, sir.
Thank you, Dr. Gautam. And one more line to add in Dr. Gautam's description is he is also one of the member who is following our workshops, Swara Homeo Gurukul workshop from past 2 to 3 years, and very dedicated homeopath, young homeopath from Rajhamundry. We wish all the best for you, Gautam, for your bright future.